Now, the lower stage is what we call low-range inflammation. The low-range inflammation it comes into the body system when the autoimmune cells are just developing. When they are transforming, you feel that pain, and you can even treat it, and it goes with pain relieving, and later it will come back again. So that is what we call the low-range inflammation. That is the first category. Is the first category. And at times, the second one, we don't feel the inflammation. We don't feel the swollenness. We don't feel the inflamed tissues, like the case in that of the thyroid gland or the kidney. You don't really feel it. Even on the spleen, you don't really feel it. And this damage continues. And that is why we call it a silent killer. There's no other name to give to an enemy. The enemy within that does not give you notice that he has stepped into your body. The enemy within that actually translates. He was used to be your protector, but he has translated to be your enemy. So we don't feel it. That is the type of the category. And then when it happens like that, we need to be sensitive. We need to come to that reality that is an enemy and is a silent killer. Now, the third one is at times we feel the effect on the pertaining organ. When we begin to carry out tests, and then we discover that the particular organ is not functioning as it ought to. For example, the attack of the autoimmune cells on the pancreas. Suddenly, without taking sugar, but you find out that even without taking sugar, your fasting blood sugar is increasing. It's questionable. We need to carry out the test to be sure that the autoimmune cells are developing. And if they are not developing, we will equally know. Do you understand? And as such, we will know that it's a secondary diabetes. That is type 2. And then you will begin to look at the factor that is possible. But if you are not actually taking sugary things and all those things, and you are not eating late, it's important to carry out the test. These are the categories that we put these dangerous silent killers to enable us to rise up, to the reality that we all need to ensure our safety by carrying out tests to ensure that we know that this type of autoimmune cells exist in our body, and there is need to adopt what I call the natural immunomodulators to be able to put an end, not just to take away the pain and leave the factors affecting our tissues and eating up our tissues, but to enable us to paralyze and to eliminate their existence, because they are threat to our well-being. As a matter of fact, when you say you want to enjoy your old age, it's not only by mouth after you pray. When you grab the knowledge like this, make use of it and endeavor to do the needful to enable your health to be sustained even in the good old age. So why the need for complementary approach? Of course, somebody will want to ask question. Why the need for the complementary approach? The complementary approach, we need fact to be able to establish why do I need the complementary approach. For example, you might have been under a drug and you take it for the past 2-3 years for pain. You have never been told to carry out a test to find out the existence of the autoimmune cells. Now, knowledge is coming to you and you need to rise up. Knowing this, you need to go and carry out the test. For example, the present treatment are effective on pain caused by silent killer. Of course, there are a lot of drugs very powerful that are good, because pain actually is not good and it needs to be removed, because pain alone can kill. And but beyond taking away the pain is where we are going. Is why we are emphasizing on the need for the complementary approach to putting an end to the underlying factor. The number 2 of the need is that the relief of pain does not really resolve or suppress the activities of the autoimmune. Otherwise, Why the deformation in bone? In somebody who is diligently observing the drugs, the deformation in bone can only happen when the pain have gone, but the activities still remain. The pains have gone, but the activities of the autoimmune cells, which is the primary, it still remain. It's just like what is happening in the pancreas. It's silent. So we are trying to silence the one in the rheumatoid. So when you silence it, that does not take away the fact that it can cause damage. Because actually, you have to take the same drug the following day to be able to be free from pain, and the damage continues. So we are trying to justify the need for the complementary approach, not to condemn, because there are some pain that is difficult to deal with alternative medicine. And then if you don't complement, so how do you want to get results? It will be impossible. So complementary approach is important, and that is what we are trying to establish. What are the facts that support the need for the complementary approach? The third point, progressive loss of tissue is inevitable. Of course, because you left the underlying factor and we are treating the symptoms. So it's inevitable. Loss of tissues, damage in the bone, damage in the pancreas, fast increase in the fasting blood sugar, and then damage in the kidney leading to kidney failure, and then damage in different parts of the bodies, even on the spleen, and many other organs will be affected. This justifies the importance of the complementary approach. Of course, the fourth one is that complementary approach, it offers a natural immunomodulation of both the normal immune cells and the abnormal immune cells, while suppressing the abnormal immune cells to eliminate and allow them to die out, is promoting the growth and the existence of the normal immune cells. So in other words, it is designed in such a way to inhibit the existence and the activities of the abnormal, while supporting the existence of the normal immune cells. Number 5, complementary approach offers a natural immunomodulations that suppress and help the elimination of the existing silent killer. Of course, that must have been mentioned along. Let's go to the 6th one. Complementary approach may not be able to ease off pain suddenly. I mentioned it earlier. It may not be able to ease off pain, but when you take a very strong pain relieving, that pain can be suppressed. And why that one is suppressed, you can take advantage of that comfort environment to attack with the complementary medicine to enable total elimination and suppression of the existence of the autoimmune cells that is responsible for the pain. Of course, there will be a check and balance time, a period whereby this discomfort will begin to go even without the pain relieving. That is the time you can set to be the time you have achieved a balance, and that means your immune system must have been restored and the abnormal immune cells has been fully eliminated. Many a times, complementary approach has to be done by professionals. Yes, of course. That's why it's important to know that some herbal medicines can play a multiple roles, and as such, when a professional did not handle it, you may actually be promoting the two immune cells, altogether. That's why we are talking about the natural immunomodulators. So, because it maintains a balance. So, if that supplement cannot do the check and balance, then there will be complication. Because indirectly, you may be taking something that is promoting the two, and the patient will not make any difference. So, and then in some severe cases, it requires professionals to handle it, because there are some cases, just like in orthodox, whereby you need to take something that has side effects and also take something to neutralize the side effects. So also is applicable in the alternative. So we have, in the course of treatment of severe cases, immune system down, suffering from cancer, suffering from autoimmune attack, suffering from different complications. All this has to be fully analyzed, diagnosed, investigate, and of course, the approach can only be done by professionals who understand the content of every ingredient that is being administered, so as not, to create more problem, but to solve multiple and interwoven health challenge. So, our simplified approach to this, of course, as you are listening to me, you already know you are listening to a professional in the alternative world. And as such, we have our approach in SNH Healthcare Investment Limited. First and foremost, our objective is not to keep, I've mentioned that, someone on our supplement for life, but to make you a good custodian, to sustain your new status after being treated. But we need to come out like this to explain to all our listeners and the viewers our simplified approach to cases related to autoimmune diseases. The first approach is the blood vessel cleansing. This blood vessel cleansing is where all the treatment is being embedded into. But blood vessel cleansing involves removal of all the unwanted and restoring back the full potentials of all the pertaining organs to the blood vessels. Restoring back the full potentials of all the organs and tissues that are participating in the vascular system. When we carry out the blood vessel cleansing, we ensure that all the excesses of cholesterol and the blood fat are removed, and all their side effects on the vessels responsible for the circulations are also removed. For example, because of the retainers of damaged fat and series of types of fat, a lot of people have lost flexibilities in their arteries and the veins. All these are possible during the blood vessel cleansing. And as such, when patients recover and the viscosity restore back, the flexibility restore back, the enlargement in the heart will restore back as a result of the blood vessel cleansing. And also, most importantly, the herbal ingredients to carry out the immunomodulation has now been included. In fact, from the onset of our blood vessel, it has been included. And that is what is ensuring that all the available autoimmune cells in the blood are rendered inactive. And the truth about it, for those who have just very few quantity of those type of immune cells in the body, what they discover is that the pain will just disappear. And they will not see it anymore because they are not many. There are people that, in fact, the percentage of the autoimmune is over 50. That you cannot remove suddenly. It cannot happen because as you are attacking it here, they are moving to this other place. It may take them some reasonable time. That is why we have integrated period of blood vessel cleansing, depends on the prevailing circumstance per patient. So if your case demands that you should observe it for a longer period, we are going to explain to you before even the procurement, during the consultation, so that you know what you are going in for. This is our simplified approach, and it has been so helpful, not only for autoimmune related, but for other type of diseases when handling them. For diabetes, for high blood pressure, for rheumatoid arthritis, that is autoimmune related, type 1, type 2 of diabetes, essentials and the secondary types of blood pressure. For the case of glaucoma and cataract, and then brain tumors, and then all types of ailments, even paralysis, stroke, or paralysis due to neuron disorder, and other resistant infections, and then different types of ailments. we make sure we carry out the blood vessel cleansing. And this has been the standard, and it has been so helpful. Now, come to the autoimmune that we are talking about. We also engage series of integrated herbal supplements to ensure that our objective is fulfilled. For example, there's one we call iron capsule, also available in powder. That one take care of the toxins, chemicals and non-chemicals. We mentioned chemical as part of the factors, and it's available in our system due to smoking, due to environmental factor, due to degenerated metabolic system, or unknown factor. When these things are available, we use iron capsules to remove them magnetically, and because these remain to remove the toxins magnetically. This helps us to achieve stability, and the patient can be free from damage of internal tissue caused by the autoimmune cells. Then we have IB and purifier. So IB is an immune booster, but it's not selective. We use it for cancer, different types of cancer, tumors, as a tumor breaker, and then many other purposes. But basically, because it's a non-selective immune booster, it can only be handled by professionals, because there are ways we incorporate into cases that involves an autoimmune disease to enable us not to be building back, but to be able to address, especially when the case is a complex case. So we also administer something to neutralize the effect of it will have as a non-selective immune booster. But we have purifier mixture. Purifier mixture is a selective immune booster. Selective immune booster means it will not boost the immune system that is not normal. It will boost those ones that are normal, and of course we use it for resistant infections, and also we use it to restore immunity, in its own silent way. Then we have the two products we call wellness and inflamed, which has to be mixed together. These two are ingredients that suppress, that help the eliminations of the existence of the autoimmune cells, and as such, there are two supplements put together that play the natural immunomodulations. They are the ones that do the work of the natural immunomodulation. Every other one I mentioned now, they complement the job, remove the toxins. But when you are talking about the aggressions of the autoimmune aggression in the body, causing pains, causing damages, the wellness and the inflamed are most primary in carrying out this assignment. And as such, stability can be achieved. Ladies and gentlemen, I would like to challenge you, as I come to an end, to endeavor to share what you have just heard, because in sharing you are blessing others, and also you are also promoting the awareness of the good work that SNH Healthcare Investment is doing in the life of many. And also, I will encourage every one of us to endeavor to subscribe into our YouTube and like our Facebook. So as you do so, you find out that you will be getting our update as informations are coming out from our organization. You'll be having an update and information to share with your friends and your loved ones. I remain yours, Wale Shola Adetoyi, the MD and the CEO of Savior Natural Healthcare Investment Limited, situated right here in Abeokuta, Nigeria. If you want to reach out to me on my WhatsApp, that's where most of my patients, and by the grace of God, across the globe, we presently have patients 65% with zero contact. That's why in soonest weeks, we are coming up with an application that will enable you to subscribe and get treated with our application support wherever you are all over the world. So these are the numbers for now to consult with and to reach me. You can reach me very fast on WhatsApp, especially when you send message. I will respond to you quickly. Because of some network issue, you can call on WhatsApp as well. I will equally respond. And of course, you can call me directly. We have +234 80 08034656362. You can also reach me on these two numbers. You can reach me on WhatsApp also, please. +234 8028 440484. These are the numbers you can reach out to be able to get consulted and get your product delivered to you wherever, anywhere in the world. Thank you for listening. God bless you. Bye for now.